Good evening. My name is Marlene Burgos Stewart, and I am the Administrative Chair for the Nursing and Nurse Aid programs here at Blackhawk Technical College. Together with our nursing faculty, our team would like to welcome you to the nursing pinning ceremony for the ADN graduating class of spring 2024. I would also like to take this opportunity to introduce you to the people that your loved ones have been spending all of this time with these last couple of years. Faculty, when I call your name, please stand and wave to our guests. In first semester, we have Sue Potter. In first and second semesters, we have Patty Aronson and Melissa Fisher. In first and third semester, we have Jim Cobbs. In first, second, and third semesters, we have Julie Lose and Tracy Hayes. In third semester, we have Kirsten Eckerman and Dr. Mallory Bowling. In fourth semester, we have Tracy Newcomer and Mary Mather. In our skills lab and also helping with our clinical, we have Chris Markline and our wonderful administrative assistant, Carrie Briggs. And we really could not offer all of the rich educational and clinical opportunities to our students without our adjunct instructors. Please stand when I call your name. Angel Reese. Dawn Corral. Laura Johnson. Terrell Canada. Colleen Rear, Julie Howard, and Tom Folliard. Thank you all for all of your help. And finally, thank you to our college president, Dr. Tracy Pierner, our vice president of academic affairs, Dr. Karen Schmidt, and our dean of health sciences, Moira Lafayette. Thank you for your work and support for our program. Our students worked very hard to get here today. And we would like to thank each and every one of you for the patience, support, and encouragement that our students received from you during their time here in this nursing program. We truly thank you. Graduate nurses, you are soon to be our colleagues. Remember your duty to treat every human being with respect and compassion, and never, never stop learning. Now you have one more very important task to complete. Pass that NCLEX state exam. Get that registered nurse credential that you have earned. You will be participating in the NCLEX review for the next 3 days next week. Take advantage of every minute of that education, pass your exam, and take your place in this amazing profession. Your futures are bright. The sky is the limit on how far you can go. We are also very proud of you, and we are honored to have been part of your journey, and we wish you nothing but success and happiness. Thank you. At this time, I would like to call to the stage our student speaker, Melissa Nandry.
Hello, everyone. My name is Melissa Nandori, and I am honored to be speaking on behalf of the 20 nursing graduates of spring 2024. I would first like to begin by recognizing the amazing staff and instructors and educators at Black Hawk Tech. To us, you are so much more than instructors. You have been our advocates, our role models, our cheerleaders, and sometimes just the shoulder we needed to cry on. Unless, of course, you're Jim Cobbs. But even Jim, although he will tell you otherwise, has always been in our corner, pushing us to our limits and sometimes even past our limits to make sure we are going to be successful in our practice. And although at times we may have said some not so nice things at 2 a.m. when we are cramming for that exam, we are so grateful for the knowledge and compassion you have given us over the years. Next, I want to say thank you to all of you here this evening celebrating this wonderful achievement with us. You can ask any of us up here, and we will have a laundry list of things we have had to give up or put on hold because of school. But we also recognize all that all of you also had to make sacrifices. I am personally familiar with those sacrifices, having to make the difficult decision to prioritize my studies over being a wife and a mother. You all have been so selfless in these sacrifices and putting some of your priorities or hobbies aside so we can pursue something we are passionate about. I want you to know how much we are forever grateful for the continuous love and support you have shown us as we embarked on this journey. Thank you for being there for every breakdown and always believing in us, even when we doubted ourselves. And to my classmates, the people who have become my friends and support system, we have shared the struggles and hardships of nursing school, and we have bonded over the increased anxiety and have talked each other off the ledge probably more times than we can count when one of us felt like giving up. That is how I know all of you are going to be successful in your careers as nurses, because you always step up to the plate to help someone out, not because it was an obligation, but because you genuinely care about the well-being of others. I know for many of us, this moment is a bit surreal. It felt like we were never going to get here. The semesters seemed to be never ending. All the long nights studying for exams, writing the dreaded care plans, having our weekly nervous breakdowns because 24 hours in a day was not enough time to get everything done. But we finally made it. It's funny, many patients and even some veteran nurses we have spoken to over the past few years have asked, why would you go into nursing after everything that has happened in healthcare? I feel bad that you chose that as a career. There is so much burnout and no appreciation. And in some instances, they're right. Nursing is hard, stressful, mentally and physically exhausting. Why would we choose to go into something like this? Because of the patients and families we have cared for and we have made an impact on. Even in our short time as student nurses, several of us have had the opportunity to provide excellent care. When a patient or family says to you, "Thank you for making a difference," or "Thank you for listening to me when no one else would," that's why we do it, because we can make an impact. So there will be days where we may cry on our ride home, and we may even question our decision to pursue this career. And on those days, I challenge all of you to reflect back on this day and how you're feeling right now. And remember why you wanted to be. And always listen to that nursing voice that we have developed during our time at Black Hawk. After today, when we go greet our patient, it will no longer be, "I'm a nursing student from Black Hawk Tech," but rather, "I'm going to be the nurse caring for you today." Congratulations. And next, I would like to welcome up to the stage our faculty speaker, Mr. Jim Cobbs.
I thoroughly enjoy being portrayed as the evil, horrible bad guy when I need a freaking walker to just get across the floor. I bought the shoes that I am wearing today in December of 2006. No, I do not keep track of when I buy my shoes. I don't actually care most of the time. But my current black wingtips were purchased because my mother called me and told me that my father was passing away. And I didn't own a good suit or a set of decent shoes to go. And my wife very wisely said, "We're getting you a suit and shoes before we go to Los Angeles." It was a horrible week. My dad did pass away. I did have to plan a huge mass and a bunch of other stuff, gave a eulogy, dealt with a bunch of aftermath stuff. And I felt like the walk I was taking in life had one less person to go with, that they had fallen away, and I had to press on. When I was going to school, like these people, going for my ADN, I used to meet with my friend Doug. Every Tuesday, I'd go to Doug's house and we'd drink coffee and we'd whine, as only two fat white American males can whine. And he would say something helpful at least once a visit, like, "Well, you chose to be in school." And then I would say, "You're lucky I'm nonviolent." You get how it went. 4 days after giving the first lecture I ever gave to a group of students set to become nurses as an actual employed lecturer, Doug called me and said he had chest pain and was going to the hospital. It was another horrible day. Doug died that day, and he never got to see me teach. I wore these shoes to Doug's funeral. Once again, the group of people that I did life with, the people that I love the most, that group was one shy. And I had to move on because I didn't have anything else I could do. My mom died in 2020. Quite frankly, COVID was going full stream. We've had a whole bunch of issues in our family because, well, you see all my jokes. You can just definitely tell I come from a family that's completely screwed up. Anyway, my brother is still in charge of my mom's funeral. It has not happened yet. However, if it does, I know what I'm wearing. At least on my feet. So why am I talking about these things? Has it all been bad? No, it has not. I got to wear these shoes when my son got married. It was an amazing day. I got to wear these shoes when my daughter got married. 2 out of the 3 times. But every time some circumstance happened like that, I had to walk on because things changed. Your son goes from more than just your son to, the husband and the father, and all of that came. And yes, I have grandkids, and yes, I like all of my grandkids way more than these doofuses. Today signifies a great accomplishment, probably the greatest accomplishment you will ever work hard for in your life. And a lot of you are like, she just graduated school. All I can tell is the people who think that ain't nurses. They don't understand. Nobody excepting other nurses will ever understand the greatness of this accomplishment. If these guys look to their left or the right, they are looking at some people that they will never forget. My mother, who passed away in 2020, to the day she died, her best friend was Joan, her roommate through nursing school, and a fellow nurse. But the truth is, move on you will. Move on you must. School is over. It's a whole new world. Every day, you're going to put shoes on, and you're going to move on. Some of these people next to you, you will literally hang out with for the rest of your life. Others you will lose touch with, but move on continue walking, lace up a new pair of shoes, you will. So I have 3 pieces of advice for you. So I hold up 2 and say 3. That's how you mess with nursing. I have 3 pieces of advice for you. Number 4. Number 1, watch the money. You're going to make more money than you've made before. And sometimes as a nurse, you go get a job based on, wow, they're going to pay me this much. But the truth is, maybe that's not the nursing role that calls to your heart. So I say, watch the money when you start off. Don't get to the point that you have to go to a nursing job you don't like because you have strapped yourself under too much debt. Number 2, be the nurse you want to be. Everybody out there who's proud of you, none of them are going to tie your shoes. Although ironically, being with a sore knee today, Patty tried to tie my shoe. Every day you put your shoes on, you get to determine the kind of human you're going to be. Are you going to love others? Are you going to lift people up? Are you going to be the nurse that walks to the car at the end of the shift that says, I did what I was supposed to do today as a nurse? You get to decide that. Not your instructors, not your family, not your kids, not your friends. It's all on you. So be the nurse that you want to be. And finally, never, ever, ever blindly put your faith in your institutions of employment, education, social structure, religion, or family. You do you. You do you. Right now, nurses are desperately needed to change the nursing culture that is going on in America today. It is not going to change until nurses change it. I have bad news for you. You are all nurses now. Job's yours. So what's the payoff? Why bother? Why do we do this? Well, one story. One of the many, many, many alcohol detox patients I cared for taught me a lesson one day. I don't recall his name. I don't recall date of birth, even when he was in the hospital. I do remember the hospital room he was in. That's how weird we are as nurses. We know, so this guy in my head is always 51 because he was in room 4951, right? But I remember him, and he was seemingly doing okay, and I'd given him a bunch of medications to make sure he wouldn't have a seizure, and I decided to go get lunch, which I was on PM shift, so it was really dinner. So I went in there, and I was so focused as a nurse, I could walk in the room, grab my lunch out of the refrigerator, crack the Tupperware thing, stick it in the microwave, hit 1 minute and 30 seconds, walk over to the table, set the stuff out, pull out my napkin, get my drink, set it there, walk back to the machine. It would be like 7 seconds to go. I'd get the thing out there, and I'd take my, not actually hot, kind of cold, but meal, and I'd sit down at the table, and as soon as I did that, the door to the break room opened, and I heard this noise. And it was an amazing noise. It was the noise of a vibrating, rustling bed. And the person who had opened the door was my direct supervisor, Cindy. And I said, "Is that?" And she replied, "It's yours." And I realized that my alcoholic was going through some painful withdrawal, and that it was time to put this person into the ICU. They needed better care than we can give. And that is exactly what happened. We went through the machinations of that, and the next thing you know, I find myself pushing this bed down the hallway, because we're going to go to the elevators, and at St. Mary's in Madison, the new area, is so big, you can run a code in the elevator. I mean, you could put 2 beds in there, maybe a stereo system. It was incredible. You're just voluminous. So we're rolling into that elevator, and the patient looks up at me because I'm at the head of the bed, and he says, "Jim, I'm sorry." So for one of the few times in my life, I didn't just have a snappy comeback that was funny. One of the few times in my life, I had apparently laced on the right shoes, and I was ready. And I actually said something that I think was helpful, and it goes to the essence of nursing. I said, "You do not have to apologize to me. I chose to be here. I am here We are here, because there were 5 other people with the bed in the, I know, in the elevator. You got to go check out these elevators, I'm telling you. And even if you come back 20 more times to be detoxed, I'm going to be here, and these people in this room, they're going to be here too. And every single time you come back, we are going to help you to the best of our ability to put you back on a right path in terms of your health, so that hopefully one of those times you're going to take that and run with it. It is, in fact, a privilege to help people like you reboot, get better, and try again. I do this because I am a nurse. And I say to you guys, lace up them shoes.
I'll do that. Hi, I'm Mary Mather, one of the faculty members here at Black Hawk Nursing Program. And tonight, I have the honor of presenting the Student Choice Award. Every semester, faculty sponsor an award to a deserving graduate. We ask the class members the following question: which of your peers would you choose to care for you or a family member as a nurse? This year's award goes to Mariana Tinajero Espinosa. And now I'd like to invite Julie Loesch to the stage to announce students for the pinning, and ask all the audience members that are going to be pinners that have the little number. We're going to arrange ourselves over here by Tracy, the faculty member, to get ready for pinning.
I know you all thought you wouldn't see me in 4th semester, but I found a way to get there. Are we ready, or is there music? Is there going to be... Mary. Is there music? Okay. No music? Music? Should I start? Okay. All right, I would like to present the first student. McKenna Balch is being pinned by boyfriend Alex Garville. Cassandra Burgett is being pinned by Grandma Karen Gill. Cassidy Fry is being pinned by parents Don and Jackie Fry. Sierra Hill is being pinned by Dad Reuben Hill. Jenna Jordan is being pinned by Mom Tina Jordan. Cassie Capon is being pinned by Mom Sarah Bell. Megan Lallier is being pinned by boyfriend Justin Dishler. Leslie Lavariega is being pinned by parents Angelica and Eric Lavariega. We congratulate Cassandra Marler. Unfortunately, she was not able to be with us tonight. Melissa Nandary is being pinned by mother-in-law Carolyn Janish. Heli Patel is being pinned by Dad Sunny Patel. Janellen Reitz is being pinned by daughter Grace Reitz. Tara Shank is being pinned by Aunt Vicky Irish. Kaylee Schimmelfennig is being pinned by Sister Serena Browning. Grace Schrank is being pinned by her fiance's grandmother, Beth Kinsey. Abby Stubendick is being pinned by fiance Dawson Draves. Dakota Thompson is being pinned by Sister Ariana Thompson. Mariana Tinajero Espinoza is being pinned by Mom Elizabeth Espinoza. Mara Waninger is being pinned by Mom Dawn Waninger. Tasha Zimmerman is being pinned by husband Chad Zimmerman and her 3 children, Lily, Lainey, and Max. As that concludes our the pinning part, I would like to welcome up one of our newest graduate nurses, Grace, to the podium.
So to finish this off, we're gonna sing, or not sing, we're gonna say our Florence Nightingale pledge. So I solemnly pledge myself before God in the presence of this assembly to pass my life in purity and practice my profession faithfully. I will abstain from whatever administer any harmful drug. I will do in all my power to maintain and elevate the standard of my profession and will hold confiance of personal matters committed to keep so much practice of my care. With loyalty, I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. Thank you guys for all coming.
Congratulations, spring cohort of 2024, and that is the conclusion of our pinning ceremony.